Yes, we may have been able to successfully secure additional supplies. When it comes to medical supplies, when it comes to personal protective equipment, when it comes to testing, it's important to follow the rules around these. These are critical resources. They shouldn't be used where it's unnecessary to use them. And I would encourage people to continue to follow that practices. Finally, you'll be pleased to know, there's a lot of misinformation out there. There's a lot of ridiculous stuff that's circulating on text messages and internets about lockdowns and all of this. And sadly, there's even been cases of willful fraud and and fraudulent preparation of documents, even recordings alleging to represent cabinet meetings and things of this nature. Don't believe it, it's rubbish. Go to health.gov.au, go to the relevant state health websites to get your information on what's happening. Avoid all that nonsense that you're seeing on social media. There are a million experts, there seems, but the experts that the government is relying on, one of the most important is standing next to me here and now. All of the state premiers and the chief ministers and myself are working with those experts, whether it's in supply chains, whether it's in workforce management, whether it's in health, whether it's in power or telecommunications. They're the people we're getting our information from. We'll continue to update you as regularly as is possible with clear decisions on what we're doing. But on the misinformation, just ignore it. If you hear it from me, if you hear it from a Premier, if you hear it from Dr. Murphy, if you hear it from those official sources and websites, that's the information you should follow. If you're hearing it from someone just saying whatever pops into their head or whatever their opinion is on a particular topic, opinions are interesting, but everybody has them. Facts are important. Information is what we need to make proper decisions on, and you need to make proper decisions on. And that's why we'll give you the information as best we can and as regularly as we can. I thank you for your patience, and I'll now pass over to Dr. Murphy.
Thanks, Prime Minister. So there are now about 454 cases of COVID-19 in Australia, and we have increasing numbers each day, but it is important to remember that the majority of cases in Australia, majority of new cases are still imported cases or direct contacts of imported cases. And our focus for those is still the same. We are getting on top of them, identifying them, isolating them, contact tracing. That remains a very, very important part of our response across every state and territory. But we know that there is community transmission. It is low level at the moment. And we know that the way to control community transmission is social distancing. The HPPC met for 2 days this week. And like the Prime Minister said, we have a unanimity of opinion across this country. Every state and territory chief health officer, plus our invited experts, plus our advisory technical committees are united on our approach. Social distancing is really important to prevent, delay, transmission in the community of this virus over coming months. But be clear, a short-term 2 to 4 week shutdown of society is not recommended by any of our experts. It does not achieve anything. We have to be in this for the long haul. As the Prime Minister said, it could be 6 months more that we have to practice these new ways of interacting. So therefore, our measures have to be sustainable. There is no way that we can lock down society, make everyone stay home, and then in a month's time undo that because the virus will just flare up again without any real long-term benefit. So we have to have sustainable measures, but they have to be serious measures. They have to be effective. And that's why we've put in a range of measures that the Prime Minister has outlined, with more information to come later. But the first thing I would say is that it is every individual Australian's responsibility to practice good social distancing. Keep away from each other where possible. Practice really good hand hygiene. Wash your hands with soap and water at every opportunity you get. If you've been on a public transport, if you've been touching things in a common area, if before and after going to the toilet, if you've been having a meal. Social distancing and hand hygiene is really, really important. But we also have to do things as a societal level, and that's why we've put in those recommendations that governments have accepted to restrict non-essential gatherings. We know that the actual numbers of infected people in our society is very low now, but if you get a lot of people together in close contact, that's the way you can spread the virus. So we need to avoid those large gatherings and limit them, but we also have to keep society functioning. So we are very focused on these measures being sustainable and allowing us to keep going as a nation whilst this virus is with us. I'd like to specifically address schools. In China, only 2.4% of the cases reported in Hubei province were in people under 19. Children have very, very few instances of clinical disease, and even if they do, of even more severe disease. This is quite different to influenza and other respiratory viruses, which have quite severe disease sometimes in children. We know that even in influenza, school closures are a controversial issue. We believe very strongly that it's in the best interest of our children and the nation at this time to keep schools open. There may be occasions when there's a big outbreak in a community that some local school closures might be necessary. But at this time, across the community, our view is that schools should stay open. Now, there obviously are measures that we can take to reduce potential transmission in schools. It's interesting in China that, again, most of the children who were infected were reported as having picked up the virus from adults in their household. But we don't know whether children may be a vector of asymptomatic or transmission with low levels of symptoms. So we need to make sure that our schools are made as safe as possible. We need to make sure that no sick child goes to school. We need to make sure that no sick teacher goes to school. We need to try and avoid large assemblies and other gatherings at schools. We know also that it's not really possible for children in a classroom to keep 1.5 metres apart from each other, and we know that we've got to be practical about that. But schools should practice very good hand hygiene too. Very hard to do in a school, but we can trust our teachers to do it. Children should be washing their hands regularly, particularly when they're eating and particularly when they're touching common areas. So it'll be hard for schools, but it would be much, much, much harder for the society if our schools were closed. We want our children to be looked after in schools. If they were at home, we know that they probably wouldn't stay at home. They would probably congregate anyway, and if transmission were occurring, it would happen. Or they may be looked after by vulnerable elderly relatives who are the people we are worried about. As the Prime Minister has said, most people with this virus have a mild disease. The people we worried most about are our elderly. That's why we've taken these measures in relation to restricting visits to aged care. But there's no sense in completely locking down aged care. Again, things you could do for a month and then stop would have no long-term benefit. We've got to protect our elderly for the long haul, for 6 months, and you cannot completely deny access to an elderly person in a residential facility to their closest next of kin. But we've got to make sure that those interactions are safe, very limited, and again, with good social distancing. So my final message is every citizen now has to think about every interaction they have with another person during the day. No more handshaking. No more hugging. No more, except in your family. You can do that in your family. No, because you're already close to your family. No more scant attention to hand hygiene. Wash your hands all the time. Use hand sanitizer. And just practice sensible practices. And also, as the Prime Minister has said, we are in a situation now where there are mainly imported cases, small numbers. There is no need for us to be in a state of heightened anxiety, but we do need to be prepared, and we all need to practice this social distancing. Thank you.
Well, thank you. Can we get a bit of clarity for religious groups and churches, synagogues, mosques on how these